It was like on cloud nine. It was, get this, it was a bluebird day. It snowed 2 to 3 feet overnight. Bluebird sky, so no clouds. It was 19 degrees outside. Never got above 26 at the base. The top of the mountain was colder. 0 to 2 miles an hour wind. I mean, it was a total epic bluebird day. Never skied a groom run except for getting to a untracked run. It was incredible. So it was like levitating down the hill. My name is Steve House, and I had a total knee replacement done by Dr. Stone. I was experiencing a lot of pain, and it kept me from doing my passion, which was skiing, or not was, is skiing, because I just put in 3 days. So it's been excellent. 6 months post-op. Yay! Not even 6 months post-op. I've had 3 knee surgeries already on the right knee, 3 on the left. The left is bone on bone, but I have no pain. My right, after the 3 surgeries, skiing, I went off on a cliff that I didn't know was there till the last moment, and when I somersaulted, I stuck it in the snow, and the impact, like whatever cartilage or meniscus was there, kind of squeezed it out, so now I was bone on bone. And it pretty much ended my skiing ability because it was just so much pain. And I made it out of the resort. It was at Palisades, and called my doc and said I hurt myself, and they said a total knee replacement. I didn't believe them. I talked to Dr. Stone. I did some research first, and his name popped up. Talked to him, and I liked what he offered. Almost 6 months post-op, and I'm able to do normal activities. My passion is back. Just had 3 days of awesome skiing, and it was incredible. So I'm really excited for it. And yeah, so it's worth it. Looking into the total knee replacement to find out what my insurance would cover and what the reviews were, and different doctors, their history and stuff like that. What was eligible under my plan, so I just have my deductible. And I was talking to my neighbor about what I was looking to do, and she says, well, my daughter told me about this podcast. I think you ought to listen to it, because I think this guy knows what he's talking about. There may be alternatives to the knee replacement. So I did some research, and it turned out to be Dr. Stone and the Stone Clinic, and they had a lot of information out there, checked out a lot of reviews, did some research, and decided, okay, it was worth to drive down here to at least get a second opinion and evaluate what my options were. One of the things that was nice too was in the reviews I was told even with a total knee replacement you could ski up, within 3 months. Some people can. And I felt, well, that's not going to happen because ski season's not going to be in 3 months. So, but anyway, had it done. Recovery time was way quicker than an ACL injury. Surgery, for me, it was way quicker, like half the time. Because I'm skiing. Normally I would not be skiing right now, I don't think, with the ACL. But the rehab, what you put in it's what you get out of it, right? And so I'm one of those that no one's going to do it for me. So, I wanted to lose weight. I lost my weight. I wanted to be in shape. I'm stronger now post-op than I was pre-op, especially with this right leg not hurting. So it's a lot of benefits, what you put in and what you get out of it. So it was like on cloud nine. It was, get this, it was a bluebird day. It snowed 2 to 3 feet overnight. Bluebird sky, so no clouds. It was 19 degrees outside. Never got above 26 at the base. The top of the mountain was colder. 0 to 2 miles an hour wind. I mean, it was a total epic bluebird day. Never skied a groom run except for getting to a untracked run. It was incredible. So it was like levitating down the hill. I never stopped, and I loved going advanced expert runs. So it was crowded that day. There's a lot of people, but Tuesday was the same thing, only because it didn't snow 2 feet overnight or 6 inches or more. I don't consider it a total bluebird day, but it was identical to the day before. They opened up new terrain, so you got a little freshy in. And then I skied 2 days after that, and incredible. It was just like, again, levitating, and knew that I believe deep inside that having this done after doing the research and reviews and everything you have to do, you should do, I felt that was worth it. And I knew it was going to be painful. I knew I was in pain every day, just sleeping, doing walking. It stopped me from my passion skiing. So if I wanted to get that back at all, I needed to do that. It kept me from doing hiking. I love to hike. It kept a lot of things out. So I felt that the reward risk, 30 years versus 20 years versus pain every day and not doing everything, the scale tipped to having it done. And knowing that 6 months of going through rehab or whatever it takes you to do it, some people faster, some people longer, it's all on you. Just get out there and have it done, eliminate the pain, and just push through it. The type of people you see down here typically are people who want to take care of their bodies, want to still go out and do things, versus going into other places where you see people want to pop pills all the time or need other services, or they're taking care of the problem instead of solving the problem. And this place solves the problem. Let's correct it before it happens. So why make it worse? The longer you prolong it, the the worse it is. It gets. It doesn't get any better than what it is today. And the sooner you get it done, the better you'll be with it.